Hello parents, ever had your kid wake up in the night with a tummy ache? It's not fun, right? Knowing why their tummies hurt and what to do about it can make a big difference, and today's talk will be about common causes of tummy troubles. We will explore the various symptoms to watch out for and how can you take care of your child's tummy pain at home and when you should visit the doctor. Why does tummy pain happen? Pain is the body's way of telling us that something is going on. And tummy pain alerts us to something that's happening inside us that we might not know about otherwise. When you get a pain in your stomach, it might be an actual problem right in your stomach, but not always. Your abdomen is more than just your stomach. It's more than just your intestine. It's the whole area between your chest and your pelvic or hip bones. With so many organs in the abdomen, different problems can have similar signs and symptoms, making it very challenging to know the reason for tummy pain. What could be the reasons we know can cause tummy pain? There could be many reasons for tummy pain. We will talk about the most common ones today, so let's start off with the first one, which is indigestion. This is a general term that describes discomfort in children's upper abdomen. Common symptoms that children complain about include pain or burning in the area between the breastbone and navel, or bloating in the upper abdomen. Most of the time, indigestion will go away on its own and is not considered serious. Try to prepare smaller meals or try a bland diet to help with indigestion. Next common cause for tummy pain can be a viral gastroenteritis or stomach flu. This is an infection which is marked by watery diarrhea, abdominal cramps and pain, and nausea or vomiting. This can become serious if your child has a high fever or bloody diarrhea or has significant pain or discomfort. Most important way to manage this condition is to make sure your child stays well hydrated. You can use over-the-counter ORS or oral rehydration solutions to help the child. Next thing, which is very common, is constipation. Constipated children have infrequent bowel movements or hard, dry stools. These children frequently complain of stomach ache, bloating, or discomfort. Usually, change in diet is needed and more fibers in their diet should be added, like vegetables. Less processed food and junk food will help relieve the constipation. You can talk with your primary healthcare provider if they don't want to eat or are losing weight or have bloody stools or are having repeated episodes of constipation. Now, sometimes the problem is not the tummy, but some other reason like stress or anxiety which is causing tummy pain. You see, when children are stressed or anxious, their bodies release the hormone called cortisol into the blood. This can trigger abdominal cramps and discomfort, especially before a test or an exam. Sometimes tummy pain can become a serious problem where you must take your child to the hospital. And the most common reason why children need to go for an operation to fix their tummy pain is appendicitis. Appendicitis is an inflammation of the appendix, and it causes sudden pain that begins around the navel and then moves to the lower right abdomen. Now, the pain worsens if children cough, walk, or make other jarring movements. Now, appendicitis pain typically increases and eventually becomes severe. And appendicitis is a medical emergency, and these children should receive immediate medical attention. Another reason for tummy pain in children that needs an operation is called intestinal obstruction. And intestinal obstruction is a blockage that prevents food or liquid from passing through the children's small intestine or colon, which is part of the large intestine. It could be caused by a twisting or narrowing of the intestine, or if they swallow any foreign object. Children commonly complain of abdominal pain that comes and goes and is located around or below the navel. They complain of constipation, inability to pass gas, swelling of the abdomen, or vomiting. And this is a medical emergency, so you should take your child to the hospital as soon as possible. Now, what can you do at home to help relieve your child of stomach pain? Stomach pain usually resolves itself after your child rests or has a bowel movement. There is no specific treatment for an upset stomach, but you can help relieve your child's symptoms by offering plenty of clear liquids to keep your child hydrated. If they have stomach flu or diarrhea, you can also offer ibuprofen or acetaminophen to relieve pain using a heating pad to ease cramps and pain. If your child has constipation, giving your child stool softeners can help ease constipation. When should you take your child to the doctor for stomach pain? Stomach pain in children is usually nothing to worry about, but if your child experiences constipation that is becoming frequent or there is recurrent stomach pain with no clear cause, you need to get this checked out with the doctor. If your child has blood in the stool or diarrhea with fever, then this needs to be evaluated by a doctor as well. Another thing of concern is that if your child is jaundiced or looking pale, you need to see a doctor. Sometimes you need to visit the doctor immediately for stomach pain. You must take your child to visit the doctor immediately if you notice the pain to be so severe that the child can't move without causing more pain. The child has continuous nausea, vomiting, or the stomach looks very distended or swelled. I hope you found this video helpful in understanding and managing your child's stomach pain. Remember, if you ever have questions or concerns, don't hesitate to reach out to me or your child's healthcare provider. For more helpful tips and resources on parenting, be sure to subscribe to my weekly newsletter by visiting drowais.com or follow me on social media and give this post a like to show your support. Until next time, keep those little tummies happy.